Pre-exercise screening is an important part within the health industry. It is a useful tool for identifying whether or not it is safe for an individual to perform certain types of physical activity. Today I will be discussing the pre-screening processes used with a new client. The processes will include new client pre-screening questions, any initial consultation notes, results of the client's PARQ and ESSA adult pre-exercise screening tools, and finally a needs analysis will be developed, and furthermore an action plan and recommendations for the client to achieve their goals will be discussed. Throughout the client's initial consultation, the pre-exercise screening form identified that the client had low upper and lower extremity muscular power and low flexibility through the hamstrings, which were affecting her performance within aspects of her volleyball, such as agile movements around the court, spiking, and blocking. Therefore, her main goals were to increase flexibility and muscular power in volleyball, aiming to improve vertical jump, spiking, and blocking, and her overall performance. Client completed the ESSA Adult Pre-Exercise Screening Tool and PARQ questionnaires in order to identify whether or not it was safe for this individual to perform physical activity by sorting them into a high, medium, or low risk category. It was found that the client was an active 21-year-old female with a height of 160.5 centimeters and weighing at 58.4 kilograms. The client was placed within the low risk factor category due to the following. She was a non-smoker, active more than 150 minutes per week, classified in the healthy range for BMI, normal blood pressure, cholesterol level, and blood sugar, no recent trips to the hospital, no current prescribed medication, not pregnant, no muscle or joint pain, and answered no to all 7 questions within stage 1 of the ESSA questionnaire. The client also answered no to all 7 questions of the PARQ questionnaire, resulting in a low presence of cardiovascular and metabolism risk factors. The client currently lives a very active lifestyle, playing volleyball at a club level, training 2 days a week and playing games on the weekend. She also studies 2 days a week and works 3 days a week. Including sporting commitments, uni, and work, she remains a very busy person on a weekly basis. This could potentially be a barrier for our client to reach her goals. After all the limitations have been considered, 3 sets of goals have been developed to counteract the issue. Health-related, to improve muscular power in lower and upper body and flexibility within hamstrings. Behavioral, to improve her time management between uni and training and work. And her performance, to improve her vertical jump, her sit and reach, her 1-rep squat, and bench throw distance. Volleyball is an explosive, dynamic, fast-paced game with many different movements in order to perform, relying heavily on muscular power and agility. The client currently plays as an outside hitter. Success in volleyball, especially hitters, are required to have high levels of muscular power and flexibility in order to increase efficiency in aspects of their game, such as spiking, blocking, and passing. Jay Shepard found a strong correlation between muscular power and absolute vertical reach height. He found as muscular power increased with an individual, the height of absolute vertical reach would dramatically improve simultaneously. Furthermore, in order for our muscles to function smoothly at a high intensity, flexibility must be increased, allowing for greater range of movement and greater force production. Shepard also found that stretch shortening cycle of muscles during explosive muscle movement in a spike and block critically impact the power in which it was produced, affecting the overall height reached. It was found that regardless of standing height reached, there was a significant increase in block and spike height with methods of strongly muscular power-based training, meaning players within my position such as my client should have an increased height within block and spike, ultimately having advantage over the opponent. Gabbett found that there were small correlations between hamstring and lower leg flexibility and passing accuracy and technique. Increasing range of movement through the hip and knee allows for the player to prepare quickly in a squat position for a pass, allowing overall performance to increase, which was one of my client's original goals. Upper body power and strength was also considered to be a major role in volleyball. Lewis found that spike velocity correlated significantly with power and strength performance of dominant shoulder and dominant elbow in the contact mode. Increasing power with the upper body of the client will allow for an increased ball velocity during the spike. In addition, McFarlane found elite volleyballers with increased range of movement within internal rotators illustrated increased velocity of the volleyball when hit. As a result of these findings, it is evident as to why the client should have increased upper and lower body muscular power and increased range of movement through the hip and knee. Overall, it is evident that the client is eligible to participate in strenuous physical activity, and that volleyball requires high levels of muscular power and range of movement. So it has been determined that the client has been prescribed a resistance training program, which predominantly focuses on lower and upper body power. A non-linear periodization format will be used involving high-volume sessions and high-intensity sessions in the same week. This has been proven to be more effective in increasing muscular power. With this in mind, exercise for the upper body will be bench press and medicine ball wall slams, and lower limb exercise such as squats and box jumps. These exercises will both improve muscular power of the upper and lower body, and closely mimic movement patterns within game situations. Lastly, after each session and training, the client will participate in dynamic stretches, such as leg swings, aiming to stretch the hamstring. Gibson states that dynamic stretching shows a high correlation with improving range of motion in the lower extremities. Clients will be closely monitored through the training program, and at the end will be subject to testing. The lower body testing will be the vertical jump height, upper body will be bench throw distance, and lastly, flexibility would be the sit and reach test.